The ClotMaster Hula Cup is staged with sterile towel and sterile syringes and a double-ended Lurlock connector. Blood sample is drawn from the patient of at least 15 cc's of blood. The 15 cc's is transferred into the Hula Cup. The cup is swirled for 1 minute, allowing the blood and platelets to pass by the center glass rod inside the cup, rupturing 50% of the platelet membranes, releasing growth factors, setting up a cascade effect of fibrinogen to fibrin matrix. The opposing syringe is connected to the double-ended Lurlock connector. The Hula Cup is inverted with fingers over the cap and base so the matrix can be pulled out of the cup through the syringe on the top of the cup. The matrix is then attached to the empty syringe with a double-ended Lurlock and transfer the matrix back and forth for 10 to 15 times, passing through the double-ended Lurlock. And because of the port size of the Lurlock, it breaks up the long chains into shorter link chains that allow for the matrix to be injected through a 22 gauge needle. An 18 gauge needle is put onto the empty syringe, pulling out the amniotic fluid and membrane into the syringe. 1 ml is extracted. The syringe with the amnio is attached back to the double-ended Lurlock so that the matrix can be transferred into the 1 ml. The amount of matrix determined is a 1-to-1 ratio, 1-to-2, or all the way up to 1-to-10, depending on the joint, space, and tissue being injected. Once mixed, the long needle is removed. The syringe is swirled for homogeneous mixture and then connected to the injection needle that's going into the patient.